Hello, everyone. Welcome to this very, very important, one of the most awaited part of our International Low Carb Awareness Week for 2023. This is the first ever this year, and hopefully, we will be able to make a follow up on the coming years. And today, we will be enlightened as to the benefits of meat based nutrition. We are graced with the presence of no other than Dr. Shawn Baker. So, Dr. Shawn Baker is an orthopedic surgeon, a military veteran, a lifelong athlete, an author, and co founder of Rivero Health. So let's all welcome our dearest Dr. Shawn Baker. Hello, Doc.
Hey, Grace, thank you for that welcome. That was very nice. Thanks. I'm glad to be here and get to talk to some of the people, I guess, in the Philippines. So it'll be neat to share some of this
Yes.
information. Yeah.
Yeah, so we have an ongoing, growing community of low carbers, and we started before with just eliminating simple carbs, and then eventually we moved on to elimination of starches, like the big starch, especially if you know Asians, we are a big rice eaters and bread and pasta and pastries, but now we are actually removing all those. And I think after a while, we've been going on for about 5 years now. We also started seeing that as much as vegetables are low carb, lower in carbohydrate content, lower in sugar content, yet not everyone can actually tolerate so much of vegetables. I myself, as one of our experimentations in our family, there's at least 2 weeks that we did a vegan or vegetarian, almost vegan diet for 2 weeks, and we thought it's gonna be better, but actually we felt worse, and we never went to that road again. And that's also around the same time, I think it's going 4 years now, that we also appreciated the benefit of mostly carnivore, mostly meat-based eating. As I say it, I just say that if you are already satiated or saturated with all of these meat, then you can have some vegetables from time to time, but know that it may not be a requirement for you. Like you can really have a full health just mostly on meat based eating. And I want to hear it from you, being an author and a practitioner yourself. We can discuss what are the different kinds or just few major concerns of people when it comes to meat-based nutrition and generally the benefits of meat-based nutrition. So if it's okay, can I ask you some questions, Dr. Shawn?
Oh, yes, of course. Yeah.
Okay, so in a more practical and scripted sense, how can you describe carnivore diet or meat-based nutrition, especially for someone who is hearing this one for the first time?
Yeah. Well, I mean, many people kind of make it as a lifestyle, or they do it for, weight loss reasons or things like that. I, as a physician, tend to think of it as a therapeutic protocol. And I think that, people should consider, if they're suffering from some sort of disease. I don't know how much obesity has started to affect the Philippines. I suspect it's probably increasing like like it is around the rest of the world. And for things like autoimmune conditions, for things with digestive problems, even mental health disorders like depression, it's been very, very effective. And so I think for 3 to 6 months, something like that may be a good way to do this. What does a diet look like? Well, it's pretty much just animal products. It's a lot of meat. It's like eggs. It might be seafood. It might be I don't know what's popular in the Philippines, but we do a lot of beef in the US. But I mean, you might find that there's more seafood or pork or things like that in the Philippines.
Yes.
And you can certainly do it with that. And so I think it's the concept is that meat provides really, really high quality nutrition. We get very good, very bioavailable, perfectly balanced protein sources. The fat, which contains all the fat soluble vitamins, is very important. Meat also has, I know in particular beef, for instance, has something like
Yes.
70,000. That's 70,000 individual nutritional components, many of
Wow.
them including phytonutrients, which we think, well, where are you going to get your
Oh,
phytonutrients that are in vegetables? They're actually in beef. The animals tend to accumulate that, and I'm sure in pork and others, it's not too different. But it is something that people will use as you probably recognize the benefits of a lower carb diet with regard to insulin sensitivity, diabetes, weight loss. It has all those things, but it also has been particularly, I think, I'll call it soothing to the gut in a way. It's very well tolerated on the gut for most people. Now there's some people that maybe the fat is something they have to adjust to, but for the most part, as opposed to, like you mentioned, a lot of vegetables, a vegetable heavy diet may in fact irritate because it causes bloating and there's a lot of discomfort that's often attached to that. A lot of people don't tolerate that well. In fact, there's some recent studies just published looking at, for instance, colitis. We see things like Crohn's disease, also colitis.
Mm.
Literally yesterday came out there showing that fiber actually made that disease worse by its interaction on the gut microbiome. There's a particular
Mm.
species of bacteria called Mucospirillum,
Mm.
that leads to worse Crohn's disease flare-ups. And so there was also a study last year looking at rheumatoid arthritis, and they showed that higher fiber diets actually made rheumatoid arthritis worse, again through the mechanism through a gut bacteria called Prevotella.
Mm.
So there are, a number of reasons why you might want to do this. I tell people, do it until you fix yourself, and then you can kind of figure where you want to go from there. But it's
Mm.
a very powerful elimination diet at its very
Yeah.
base, and I think that's where it should be primarily used. Some people enjoy it so much because they just enjoy it and they continue to do it for many years. In fact, myself, I've been on doing it for 8 years, and
Wow.
I am still here and I'm still doing well, and I haven't got any health issues. Basically, I've
Mm.
been able to do this very successfully, and quite honestly, I quite enjoy it. So it's fun. I know there's a lot of people say, well, what about the rice and the desserts and the vegetables that they like? And interestingly, many people find that after a month or two on it, you don't want that stuff anymore. It's really weird. Is you just don't want those other foods because many people are addicted to these foods. And I know that probably food is probably very important to the culture there. And there's a lot of people that like to eat a lot, like to eat quite frequently. And so, trying to figure that out socially can be challenging for sure, but you can make it work.
Thank you so much for that, Dr. Sean. I agree with all of those things that you said, and I can really remember the time that when we were doing that 2 week almost plant-based eating. I think it's really 100% plant-based eating. We really felt bloated, and I it made me recall the time that when I was not conscious about how we eat, it's already normal for me to have that stomach ache in the morning when I wake up. But now, since I consider it as clean eating, which is 80 to 90% running 100% of that, mostly in many days that we do meat-based eating, we actually didn't feel any of those stomach ache anymore. So I guess that leaky gut problem, that problem in the gut, really, the IBD, irritable bowel diseases, irritable bowel syndrome, are already causing so much after accumulation of course, not the vegetables. I feel like, correct me if I'm wrong, I feel like it's really not the one that causing it. It's actually part of all of those processed food combined, and all of those inflammatory food, that even these vegetables and fibers eventually our gut can no longer take it anymore. So I consider meat-based eating as one of my resetting kind of food, that when I don't feel so good, I will go to clean meat-based eating. Yes, beef. We also have beef here, but beef here in the Philippines is quite chunkier and quite tougher. I think it's the toughest beef in the world. And also pork, seafood, eggs, all of that. And when we usually go back to that kind of eating, we feel a lot better. We feel lighter. We feel satisfied, but not heavy satisfied, like the one that you get when you eat all of those other foods, especially carbs. And I'm so grateful that you're able to enlighten us. But it made me curious. You said you are already on meat based eating for 8 years now. So, what started your journey from the typical standard American diet, what we call a SAD diet, into a low carb, meat based, or carnivore kind of lifestyle?
Yeah, well, I'm now 50. It's going to be 57 years of age. And back when I was in my early 40s, I had noticed I was just putting on weight. I wasn't feeling good. I probably was developing metabolic syndrome, and I didn't really like that. So I said, well, I was an athlete, so I was already training very hard. I was exercising every day and doing very, very aggressive exercise. In fact, I was a world champion athlete, but I was developing metabolic
Wow.
disease, and I didn't like that. And so I started to look more into nutrition. And so the initial thing I did, and this is back, 2012, maybe, 10 years, 12 years ago, I reduced my fat, I ate a lot of vegetables. I ate lean protein, and I did lose weight. I did lose weight,
Mm-mm.
but I felt miserable. I was hungry, tired,
Mm.
irritable. I was just, it just didn't work for me. I couldn't sustain it. And so then then I progressed through various different versions of a paleo diet and then low carb keto over about the next 5 or 6 years. And then I discovered these sort of crazy people eating nothing but meat, which I thought was really crazy at the time. I really did. And but I was curious, and so I kind of followed along for about 6 months, and finally I'd seen enough to say, well, let me try this and just see.
Mm-mm.
And so I started out I just had one meal. It was like I'm going to have steak and eggs for one meal, and I ate it. And I was like, oh, that's pretty good. I like it. I enjoyed it, and I felt okay. And then I did a day, and then 2 days, and then 3 days, and then a week, and 2 weeks, and finally I did a month of it straight. And by the end of the month, I was like, this is the best I've felt in a long time. I can't remember feeling this
Oh.
good. I felt like I was, 10, 20 years younger
Mm.
with regard to how I felt. And so at the end of the month, I said, well, that was a month experiment. Let me go back to my regular sort of mixed omnivorous diet. And I immediately felt worse. I was just like, well, my stomach didn't feel good. I started having aches and pains.
Mm.
And so I realized that I'd rather feel good, because at that time I was almost 50. And
Mm.
so I went back on the meat-based diet, and I've been on that ever
Mm.
since that time. And since that time, I was able to break world records as an athlete, and I've been able to just, do really, have really good health, I think, for someone in their 50s, particularly compared to the people around me in their 50s. A lot of them,
Yes.
if you haven't been to America lately, the USA has got a lot of people that are really, really sick, and it's unfortunate. And to your point, it is all this hyper processed food, the sugary stuff, the highly refined grains, the shelf stable stuff with all the different chemicals and preservatives and thickening agents and emulsifiers and stabilizers. It's just garbage that we
Mm.
eat so much of, and it destroys our gut in a way. And I think the carnivore does reset that in a very powerful way. And so that's kind of how I kind of do this. And of course, literally hundreds of thousands of people have now done this, and we're all seeing,
Yes.
with rare exception, quite good results. So it's kind of interesting to watch this sort of develop as it grows, and it's becoming kind of a, it's like I said, I'm
It's a
talking to you.
movement.
Yeah, I've been talking to you in the Philippines last week. I was talking to India, and then I was in Germany last week for a conference. Just going around the world, it's growing
Mm.
tremendously, and it's really just fun to watch this grow. As I was one of the guys that kind of, maybe, as far as calling it a
Yes.
carnivore diet, I was a guy that came up with that, and it's grown pretty interestingly. It's been fun to watch.
Thank you so much. And I think I would like to make a shout out in one of the Facebook groups that I first came in contact a few years ago, the World Carnivore Tribe. I think
Mhm.
you're familiar with that. And there are a lot of testimonials every day, day in, day out, of people really going into this diet after experimenting with so much more. And I think you, as a doctor yourself, we've been critical, we've been doubtful at first. And before we jumped into carnivore, we also followed the dietary guidelines to lessen fat, lessen meat, lessen red meat, lessen salt, and all of those things. And we just see ourselves not doing so well with it. We didn't feel any good. And I think that's the time that our instinct to listen to our body kicked in, and not just listen to what these suggestions are usually saying that we've been following also with our patients. So thank you so much for that, Dr. John. And I believe since then you are also, since you see yourself benefiting from it, and it's like at no added cost at all, you can just stop yourself from helping others as well, like extending these knowledge to your patients first before you shared this to the whole world. So, can I ask which are the top 5 conditions you see in your practice who can benefit the most from meat-based diet or meat-based lifestyle?
Well, I think, again, the things that we see more commonly are the things I've seen the most success with. So, number one, obesity. I mean, there's a lot in the
Obesity.
United States. 70% of our population is overweight or obese. We got 42% obesity rate, so it's helped that tremendously. It has helped with, believe it or not, arthritis. A lot of people, when they're inflammatory, their systemic inflammation goes away. A lot of times they feel better. Their joints feel better. So that is occurring. 25% of our population has mental health issues, and so it also helps with mental health, whether it's depression, anxiety, bipolar disorder, even things like post-traumatic stress disorder seem to get relief from that. We see people with all kinds of digestive issues, whether it's IBS, also known as irritable bowel syndrome, or in fact IBD, which would be the inflammatory bowel disorders like
Mhm.
Crohn's disease or also colitis. That's been wonderfully successful. Many of the autoimmune conditions, psoriasis, rheumatoid arthritis, even multiple sclerosis, we've seen benefit with that. Like I said, mentioned some of the skin disorders like psoriasis, eczema. We see blood pressure, these cardiometabolic, diabetes is a huge one. I mean, we see people that are diabetic that are, A1Cs of 10, 12, 14. Within a few months on carnivore, they've almost normalized their blood glucose. I mean, they come back with
Mhm.
a normal hemoglobin
Yes.
A1C. They've come off so many of their medications. In fact, the study that Harvard University did on this diet back in 2021 showed that of the 225 diabetics that were in the cohort, 92% of them were able to come off all insulin, which is remarkable. And
Mhm.
100% came
Wow.
off all the other injectable medications like the SGLT2 inhibitors or the GLP-1 receptor agonists. And then 84% came off even the oral medications like metformin. So we're seeing tremendous success across the board with just about, I hate to make it as a panacea, but just about every medical condition out there will benefit from better nutrition. That's clear. And a
Right.
carnivore diet, in my view, is very good nutrition. And so I think it helps just about any condition out there. Um, but yeah, the ones that are more common are the ones we see more and more success with, just because we see so much of it. So, but we've seen some really weird ones, like
Mhm.
Ehlers-Danlos syndrome, which is a connective tissue disorder. I had a patient who was another physician, an emergency room physician, and she would wake up every day with her joints displaced, joints dislocated. Her ankle
Ooh,
was
oh
dislocated,
my
her shoulder
God.
was dislocated, her wrist was
Mhm.
dislocated. Every morning she'd wake up because at night she'd turn and all of her joints would dislocate. And so she'd start her day that way. And then she'd go to the emergency room to work, and half the time her shoulder would fall out of place or something like that. So it was really, you can imagine, that's kind of a little bit of a nightmare scenario. She went carnivore within a month. She stopped having dislocations. It's like they just stopped dislocating. And then she started able to start going to the gym and working out, lost weight and got stronger. That's interesting. There's something called Tourette's syndrome, which is another interesting disorder where, you have these weird vocalizations, this weird sounds come out of your mouth. And sometimes you make swear words and weird facial tics and motor things. That went away on carnivore. So, I mean, I've seen
Mhm.
some really incredible things that I didn't expect, because these are all genetic
Mhm.
disorders in many cases, or at least
Yeah.
Ehlers-Danlos is, that actually get better with this. So, in my view, really any condition out there, I don't care what it is, whether it's cancer, dementia, diabetes, better nutrition is almost always going to help. And I think, in my view, a meat-based diet is some of the best nutrition you can get.
Yes. Thank you so much for that, Dr. Sean. And I agree there's one time that I was the referring consultant, although I practice as a surgeon, but I have this orphanage where I'm the one that's clearing the kids, doing their annual checkups. And there's this kid who just have a very weak. I suspected that he had a problem with his adrenals. And then without, because this was in the province and there was no available laboratories to confirm that. So I just asked what the usual diet of the kid. And then just by elimination, if he hadn't tried mostly meat based eating, he would just try it. And then the nurse followed up. After a month, he's doing so well. The lumps in his legs already shrink, and then he's playing already just like a regular kid. And there's also this one girl I met having problem with fertility and already failed a lot with IVF. And then because I'm also pregnant right now after a miscarriage, and immediately after I get pregnant, so she just asked what I did, and I just said that I just eat mostly carnivore, mostly meat. And she also did the same, and in a few months time she got back to me and said she's already pregnant as well. So yes, these illness are the ones that we see commonly in our practice. And I think by number, these are the most issues that people are actually dealing right now. But practically any illness at all, if you haven't tried carnivore way of eating, meat-based eating, then it's really worth the try, and you can see yourself, you can feel yourself all the difference. So thank you for that, Dr. Sean. And since these patients, and especially the ones who are watching us right now, would be a little scared of the many other issues that we've been bombarded ever since we were young, or I think we've been brainwashed to fear red meat over the last 10, 20 years. One of the major concerns of people are those with when it comes to our kidney function. So, for those with kidney problems and hyperuricemic state, what are their options? You think they can also do meat based? Should there be different macronutrient proportions? Should they lower their protein content and eat mostly of the fatty content? What are your take on this?
Yeah, well, I mean, first of all, when we look at why do we have kidneys that are failing? We see people with chronic renal insufficiency, chronic kidney disease, whatever you want to call it. Often, the assumption is that protein has something to do with that. Well, we know that on further testing, this comes from back from a hypothesis that was generated back in the 1980s by a guy named Dr. Brenner. And that data was all basically secured on animal studies, particularly like mice and rats. And so in human studies, however, when you actually do trials and not just because there's epidemiologic studies that suggest that higher protein diets are associated with renal disease, but there's a lot of confounders in that. And when you actually do the trials on that, and Stuart Phillips in 2018 did a really nice paper looking at, all the data on higher protein diets and kidney disease, and show that higher protein diets really don't have any sort of negative impact on the kidney. So I don't think you need to dial back the protein. What they are seeing, and David Unwin, who's a friend of mine, who's a GP in the UK, has published a nice series on patients that were diabetic that had kidney disease, and he put them on higher protein animal-based low-carb diets, and guess what? Their kidney disease got better. It actually got improved significantly. And I've seen that clinically in my observations with many, many patients as well. And so it's really cutting out, like we mentioned earlier, the ultra-processed food, the refined grains, the sugary products, the things that tend to lead to hyperglycemia. That's really going to make the biggest impact on your renal function. And the other thing is, how do we assess renal function? I think one of the problems is we often use what's called a creatinine based assessment. We often get a basic chemistry panel that has a serum creatinine, and we calculate something called a GFR, glomerular filtration rate, which is an estimate. The problem with that test is if you're eating a high protein diet, or if you're working out hard, or if you have a lot of muscle mass, it's going to be artificially elevated. Now, the way around that is to do a different test called cystatin C, which I don't know how widely available is in the Philippines, but it's a far superior test, and it'll show you, like, for instance, when I check my own personal, because I'm a big guy, I got a lot of muscle, I work out all the time, eat a lot of protein, my GFR is always low based on serum creatinine, but every time I test it using cystatin C, it shows it's normal range. And so it's not having the right measurement tool. Now, the second part of the question talks about hyperuricemia. And so what is the main thing we worry about when we think about uric acid? Is gout is a clinical manifestation. And so what I typically see, if someone is suffering from gout or hyperuricemic, it's usually becomes symptomatic in the context of metabolic disease. Usually most people that have gouty flare-ups also have something going on metabolically, whether it's prediabetes or insulin resistance, or maybe diabetes, metabolic syndrome, something like that usually precedes that, or is associated with that. And so typically what we see is, as you go on a meat-based diet, those metabolic parameters get better. The hyperglycemia normalizes, the inflammation goes down. And so the uric acid becomes less of a problem. Uric acid, what is the role of uric acid in the body? Why do we have it? Well, it's an antioxidant. I mean, uric acid is one of the most abundant antioxidants we have in the body. So we need uric acid. Now, sometimes when it's elevated, and all these other factors, the metabolic factors, the immune system factors, are in the appropriate levels, then we get things like gout, which are a problem. And so I don't think hyperuricemia is a contraindication to a carnivore diet. Now, initially, if somebody is really metabolic, let's say they're bad diabetic or something like that, initially going carnivore, they may have a flare-up, and you would treat that as you would normally. Typically we use things like allopurinol, colchicine, or some kind of anti-inflammatory as a main front line for these medications. But usually over time, 2 months, 3 months, 4 months, 6 months, that all goes away. And most people long-term carnivore, even if they started out with gout, it improves and goes away. And my, for reference, I eat, I know this will sound kind of crazy, you guys, but I eat probably some days 1.5 to 2 kilos of beef a day. It's a lot of food, right? My uric acid is typically normal. It's just, it runs, normal range. It never goes high unless I test it like right after, immediately after I eat, then it may be bumped up a little bit because I had a home uric acid meter that I played with for a little while. But really, I think it's more that concern about hyperuricemia and really kidney disease is really based upon metabolic disease. It's the things that lead to metabolic syndrome, which, as you probably are aware, it's obesity, it's hyperglycemia, it's low HDL, high triglycerides, and hypertension. I mean, that's sort of the metabolic syndrome picture. And so if you can fix all those things, generally those issues, the kidney disease, the tendency to gout and inflammation go away.
Thank you so much for that, Dr. Shawn. I would just like to clarify what you said when it comes to GFR measurement. So, for those who are not aware, it's the glomerular filtration rate. Usually, that's the one that we try to calculate as to check how's the kidney are functioning. As you know, our kidney is just like a filter for our body, so it filters everything. And as what I always say, these things are not really the perfect, especially creatinine. It's not the perfect measurement because these are just the byproducts. But what you can really see when it comes to your kidneys may be something else. So, but in it, make it just a little easier for our audience. Would you consider cystatin C better gauge when it comes to kidney function rather than creatinine?
Well, I think in the context of a higher protein diet, yes, cystatin C would be a much
Hyper
more, it would be a much better way to
better
do that
gauge.
because, like I
Oh,
said,
okay.
if you use creatinine in a high protein context, it could be that the kidneys are failing, or it could just because you're eating high protein. It's hard to discern the
Yes.
two. So
Yes.
you need to verify that. And again, as you mentioned, EGFR is an estimate. It's not an actual true
Yes.
measurement. It's just an estimate
Yes.
based on these other biomarkers. If you want to really measure your GFR, then there's ways to do that. There's, you can do, like, I think it's inulin challenges. There's things that nephrologists will do to actually measure it. Sometimes it requires a 24-hour urine collection. But again, a cystatin C is a quick, easy way is to, because if you got a patient that, their creatinine is bumped because they went on a high protein diet and you're worried about it, rather than tell them to stop eating protein or send them to a nephrologist, just get a
Mhm.
cystatin C and you can clear it up pretty quickly.
Oh, thank you so much, Dr. Sean. And before we proceed, can I just ask another again when it comes to kidney function? Because as you said, you are not sure if Philippines has a lot of obesity. You are right. There's not much obese in the Philippines, but the problem is in here there are so many who are suffering from metabolic syndrome, metabolic illness, insulin resistance, and its outcome and its complications, that there are so many dialysis center everywhere you go. Even in a place where it's already somewhat far flung from the city, there's already a dialysis center coming up because there's just so many. I just learned that my 30-year-old cousin is already on dialysis 2 to 3 times a week. Imagine that one. We weren't able to recognize him the last time we saw him. So these things is no longer surprising here in the Philippines. And these people are not actually obese. They are thin, they look fit, they look normal. 20s, 25 years old, they're already on dialysis. So, as much as when it comes to these concerns, especially the ones who are not yet aware, they're really afraid. They're almost not eating proteins at all. Although CKD5 may be considered as really irreversible. Although I really don't lose hope because I know as long as we have at least 20% of kidney function, we can still function well. Would you consider avoidance of protein at all beneficial for these cases? Because from what I've read, it could actually worsen with their condition right now.
Well, I mean, if you have to look at what got them there in the first place, and as you mentioned,
Yes.
in the Philippines, probably people eating lots and lots of protein is probably not a thing. It's probably they're consuming a lot of refined carbohydrates. And
Carbs,
you
yeah.
mentioned lots of rice, probably lots of sweets and things like that.
Processed foods.
So those are the things that are actually driving the disease. And I
Mhm.
think that even a patient on dialysis could do a meat-based diet, in my view. I mean,
Mhm.
obviously you're still on dialysis, but I've literally seen people go from certainly 3, 2, and 1 back to normal. Whether somebody can go from 5
Mhm.
to class 2 or 3 is potentially
Wow.
interesting. The thought is that protein causes hyperfiltration or stresses the kidney out, and the kidney has to sort of adapt to that. And I look at the way that, and a lot of times we'll see people that are on higher protein diets have bigger kidneys. Their kidneys just get bigger, right?
Mhm.
There's more tissue that develops that. It's kind of like exercising to get bigger muscles. And, you would say, well, there's nothing wrong with that. I mean, and what happens when we look at older people, right? When we look at older people and we do a CT scan or an MRI on an older person, everything has shrunken down. The kidneys have shrunk, the brain has shrunk, the bones have become osteoporotic, the muscles have
Mhm.
shrunk, the skin is thinned out. So we want robust, thick, strong organs, just like we want big, strong bones and big, strong muscles. That is a better way to be. So I don't think even somebody with CKD5, chronic kidney disease,
Mhm.
class 5, I think they could benefit from one, eliminating all the processed food at the very
Yes.
least. And maybe, maybe initially you kind of moderate the protein a little bit, maybe switch to a little bit more of a fat macronutrient composition.
Yes.
But gosh, I mean, the big problem is not the meat. It's not the protein. It is the ultra processed food. It's the sugary stuff. That's what's killing, and that's what's killing the kidneys in almost, every case with rare exception.
I couldn't agree more. With I've handled cases also with CKD, and I've seen the same from CKD 3 to coming back to 1, CKD 5, from dialysis of almost every other day. It's now down to just twice a week, or sometimes just once a week. There are those kinds of improvement, but I never promised anyone, especially that you cannot really be there to check what they're eating, that they can really comply with it. But what I say is, it's not the meat that really gotten you into that situation. And even if you are on dialysis, say for example, it's already a given that your kidneys are zero functioning, no longer functioning, then so be it. Your kidneys are no longer functioning and it's now being replaced by the dialysis machine. But it doesn't mean you no longer have the other vital organs that you should protect. It's just that all of those inflammatory foods, junk foods that you've been eating, carbs, damage your kidney first. But it doesn't mean it will stop there. If you continue eating junk while you're on dialysis, it's just a matter of time that it will also reach your brain, reach your heart, reach your liver. That's why people on dialysis seldom die of increased metabolites from the failure of dialysis or the kidneys function, but they still die of heart attack, still die of stroke, still die of the same complications, not directly related to kidneys, but related to their overall metabolic unhealth. Would you agree with that, Dr. Shawn?
Yeah, I mean, whatever is destroying your kidneys is destroying the rest of your body. And I mean, I think that correct me if I'm wrong, but the life expectancy of somebody on dialysis is often 3 years, 5 years, something like. You don't live long once you're on dialysis. It may be longer now, but I mean, it used to be if somebody got dialysis,
Yes.
they were likely going to pass away within a few years. And so,
Mm.
absolutely, I mean, you're going to go blind, you're going to lose limbs, you're going to have a heart attack, you're going to, all the dementia, all these things that are associated with this. And this is, and as you mentioned, in the Philippines and like a lot of places in Asia, and perhaps we see a tremendous amount of metabolic disease, diabetes, heart disease associated with that, without a lot of obesity. And I think that's just a genetic difference. You don't have to put on too much weight. We see like men that get just a little bit of a belly, not much, and they're very, very sick. Whereas in the United States, we have
Yes.
people that are huge.
Mhm.
And I think it has to do, I think there's thoughts on, where genetically we arose, and
Yes.
maybe if we were from a cold climate, we could tolerate more
Mhm.
fat. Whereas if you're in a warm climate, where the Philippines obviously is kind of
Mhm.
tropical, probably genetically you just don't tolerate as much fat, and if you get even a little bit fat, you're going to have problems metabolically.
Thank you so much, Dr. Sean. Yes, that's what we call tofu. I think that's thin
Yeah,
outside but
fat on
fat
inside. Yeah.
inside.
Right, right,
Yeah,
right.
and what I see in my practice also, as much as we thought these non-fat formers are at advantage, but what I can see, they're actually more prone to inflammation. They are more prone to insulin resistance and its side effects because they don't have this much leeway to accommodate all of these insulin drive, becoming making it into fats, as compared to those living in the colder countries. Here in the Philippines, seldom you see obese patients, but these people who are thin, looking slim with a little bulge in the belly actually have a lot of problems for women: infertility, aches and pains, dysmenorrhea, allergies, flare-ups of skin problems, asthma, tumors. They are prone in tumor formation anywhere in their body. So I think it's not just enough for people to consider that if you want a healthier lifestyle, you just want to lose weight, because not everybody puts on weight when they are getting sick. Some just get sick without putting on weight. So thank you so much for that, Dr. Sean. Before we end, I know it's already taking so much of your time, but can you please enlighten us? Do you have some quick cheat sheet on the major do's and don'ts in meat-based nutrition that any beginner should be mindful about, so that we can just have a takeaway when we go proceed with possibly in this way of life as we
Yeah,
go
yeah.
along?
So I think it's helpful to have to be in a supportive environment. So get friends, family on board that will support you in this, or have an online community
Mhm.
or something like that. It's incredibly important. I think the other thing is you have to enjoy what you're eating. I mean, you will never stick to
Oh,
any kind of nutritional program if you don't enjoy the food, or if you're hungry all the time. So you got to eat sufficiently. You got to eat enough to, keep off the cravings, because a lot of people have cravings for some kind of sugary thing, and you've got to eat enough. And so I say eat like it's your job, and your job is to overcome all these cravings and addictions. So I think that's important. The other thing is make sure you stay on top of your hydration, because whenever you go low
oh,
carb or higher protein, you're going to need, basically more water, more fluid. And fluid is both water, but also electrolytes. So electrolytes are what keeps the water in our body. If we just drink pure distilled water, we're just going to urinate it right back out, very quickly. And so we've got to make sure we're staying hydrated. Be mindful of the fact that your bowel habits will change. I mean, when you go on a meat-based diet, you absorb everything. Everything gets absorbed in your
mhm,
small intestines. So you're going to go to the bathroom less. It's not that you're constipated or anything like that. It's just that you just don't have as much waste to get rid of, and so you just have to be mindful of that. Um, I think it's important to just engage in, well, one thing I will tell you is, if you have a choice when you eat your meals, I would refrain from eating a big protein filled meal close to bedtime, because it's probably going to make it difficult for you to sleep, because you have to deal with the
mhm,
nitrogen. When we consume protein, our body has to deal with the nitrogen, and we break,
mhm,
we kind of break down the amino acids into their carbon skeletons, and the nitrogen is converted into ammonia, which is actually toxic. And unfortunately, we quickly convert it into the liver to something called urea, and then we excrete it. And so during the daytime, it's fine. If you eat a big protein breakfast, you might have to go to the bathroom, once or twice during the day. You get rid of that. But if you do it at night, then you're going to end up waking up in the middle of the night. You're not going to get good sleep. If you don't get good sleep, then you don't feel as good. You're more insulin resistant, and on and on and on. So it's important to time your meals appropriately, eat enough. I tell people, just eat whenever you're hungry. If you're not hungry, you don't need to eat. I think in general, I tend to be a little bit heavier on the protein, just because I think I'm so um, I'm such a proponent of having muscle and having lean mass, and I think that's important. So I like people to get around, up to maybe you guys think in kilograms over there in the Philippines. So I believe, correct? So I think, maybe you want, 1.2 to 1.6, maybe 2 grams of
mhm.
protein per body
Kilogram
weight
body
of
weight.
kilograms, right? So if you're 50 kilograms, then you probably need to have, maybe 100 grams of protein a day, or maybe 75, something
Mhm,
like that. That's a target to shoot for.
yes. Thank you so much, Dr. Sean. I'm so amazed, and it just reaffirms my initial idea that even if we didn't practice at all, we'll be speaking the same language, because how we see nutrition now compared to how we see nutrition back in medical school or back in the traditional medical training is really different. So I would like to emphasize those things that you mentioned. So get everyone on board. So as much as possible, make it inclusive, even because in here, especially, that so many people are still close-minded. We are trying to open up. So but we don't want people to isolate themselves. We want to actually help them inspire their families, inspire others, make them see that it's working on you, and it's hopefully gonna work for them as well. So that your process, your journey will be a pleasurable one, so you enjoy it, you eat enough, because there are so many right now who have eliminated their carbs when they did low carb. but they saw muscle wasting, especially in the elderlies. So that's their primary problem right now. So what I usually tell them, you are just not eating enough. And if you want to bulk up, try to bulk up on your muscle. Don't try to go back to bulk up with just fats and inflammation and just water retention in your body. And yes, hydration is very important, not just water, because what I say is when we go on lower glucose, lower sugar, lower insulin load in our body, we have this tendency to not retain water anymore. So we tend to urinate them, and it's not a bad thing. We just need to replenish them. And when we urinate, it's not just water that goes away, but also electrolytes. So make sure you have your electrolytes on, especially salt, and be mindful of bowel movement because they're actually scared that they're not pooping as often anymore. And I tell them that it's actually a good thing. It means you're not eating so much garbage anymore. Most of the food that you're eating are actually being absorbed in your gut. So you don't need to force it. It will just come to you. And I'm glad that you mentioned the avoid big protein meal at night. And I want to emphasize that it's just the big protein meal because I saw also that when you don't eat any protein at all, if it's mostly just fatty food, you'll really be pumped up. Your ketones will be so high at night that you also have insomnia. So just an appropriate amount of protein, a lower amount when it comes to when you compare it to your daytime protein would actually be enough. I find that bigger amount of protein in breakfast or your brunch. Usually we do brunch because we do intermittent fasting as well. And our second meal would be a little lighter, but still protein rich. Can you recommend, Dr. Sean, like say, for example, 30 grams of protein at bedtime, at nighttime or dinner? Would that already be enough?
Yeah, I mean, I suspect for most people, again, I always put it in
Smaller
context.
build.
I put it in
Yes.
context for me. It wouldn't be enough for me, but
Okay.
for
Yeah.
someone from maybe your size or something like that, yeah, that should probably be more than sufficient, I think.
Yes, and I also want to emphasize that at minimum, just like what you said, I think 50 kilogram weight on average is already quite small, but it's an average Filipino weight. I am also a little bigger as compared to usual Filipinos, but 50 gram, if you multiply that by 2 grams, so that's 100 gram of protein in a day. So I want to emphasize that it's not 100 gram of weight per se, of dry weight of the raw meat. It's actually about half kilo if it's like meat, if it's like say for example chicken breast or pure meat, because the raw weight is not equivalent to its protein component. So people thought before that when they go on these protein measurement that they'll be measuring because the standard measurement is in matchbox sizes and it's really really small. So that's why even if you're just 50 kilogram weight, you can actually accommodate roughly around 400 to 500 grams of raw meat weight when it comes to your daily protein requirements.
Yeah, yeah. Meat is about 70% water. I mean, so you remember most of it's water. So that you got, yeah, exactly. You're exactly right. Yeah, but about a half a kilo of meat is about 100 grams of protein, give or take, depending on how lean it is.
Yes,
But yeah, that's a pretty good estimate.
yes.
Sure.
Thank you so much, Dr. Sean. Before we end, can I have just a few more questions? Just a little more. Like,
Sure,
say, for
sure. Go ahead.
example,
Yeah.
there are those concerns that what about the vitamins that we only get from plants? Do you do what, like vitamin C or all of these other considered as important micronutrients from plants? Do you need supplements in this way of life? And is this important or temporary only for healing, or would you recommend it to become a lifestyle that people can actually go to if they want to?
Yeah, I mean, certainly I have no problem with someone doing it as a lifestyle. Like I said, I think its main utility, quite honestly, is a
Mhm.
therapeutic protocol. But as far as the concern about, am I getting different nutrients from plants that I don't get in meat? The short answer is we're not clinically seeing any significant level of deficiency in people doing a meat-based diet. What I will mention, and I can't remember if I mentioned this or not, but we know that meat, and I've got the literature on beef because that's what I generally tend
Yes.
to look at. But because an animal will graze and they have a much more diverse plant-based palate than we can consume. Like, cows can go out there and eat grass and different weeds and different leaves that they would kill us if we ate them. So they have a much more robust level of nutrition, and they're exposed to these phytonutrients. And actually, most of those phytonutrients actually get into the meat, and
Mm.
we don't usually consider that. But again, Stefan Van Vliet who formerly was at Duke University, he's now at Utah State, has done extensive testing on this and shows that meat actually has a lot of those phytonutrients in there. And the other thing is they tend to be more bioavailable, just like meat is more bioavailable in general, because a lot of the fiber that we consume, like you mentioned about going to the bathroom, if you eat a big plant-based diet, you're going to go to the bathroom a whole bunch. But guess what? That's because all that nutrition is going into your toilet. You're not even absorbing it. So you tend to absorb even the plant-based compounds that are found in the cow's tissues or the pig's tissue or whatever animal you're eating is going to make it into your body. And we just don't,
Mm.
it's just something that we haven't had the ability to test for those things for so long. But now that we have high-level testing, metabolomic profiling and things like that, we can see that these these animals actually have all these plant nutrients in them. So I don't think you need to generally supplement for most people, unless you have some sort of known deficiency or some absorptive problem, maybe a pernicious anemia, or you've had surgery and you're missing parts of your stomach, if you had a bypass, or I don't know they do that much in the Philippines, but for the most part, I don't think so. I think the only supplement that I think may be beneficial is just getting adequate electrolytes. And sometimes, particularly if you're sweating a lot, if you exercise a lot, the
Mm.
Philippines is obviously a warm, humid environment, so people are probably
Yeah.
sweating quite a bit. So you might have to stay on top of your electrolytes in that regard. But other than that, I don't really see a great need for any kind of supplementation.
Thank you so much, Dr. Shawn. When it comes to electrolytes, because most of our viewers are actually no longer beginners when it comes to low carb nutrition, can we ask what were the components of your electrolytes if ever you're taking it?
Well, so I have this. There's a commercial product it's called Element, or LMNT, and it comes pre-prepared with 1,000 milligrams of sodium, and I think it's 200 milligrams of potassium and 60 milligrams of magnesium when it's formulated. And so I sometimes I exercise quite a bit. I'm always kind of sweating and doing that. So I do that. But but let's go back. You think about it, the people that grew up in the Philippines 200 years ago, they didn't have any supplements. They had none.
Yeah.
So I mean, how did you survive? So it's kind of interesting.
Mm,
We can do fine without
mm.
supplements, I think.
Thank you so much for that, Dr. Chan. This has been a very enlightening day for all of us, and we thank you for your time. And before we end, can we ask where we can possibly see most of your work, where we can read your work, or where can people follow you so that they know where to learn more if they want to?
Well, sure. I mean, I wrote a book called The Carnivore Diet. Unfortunately it's in English, so it's it's not in
It's
Tagalog
okay.
or whatever. There's only you have to it's in English. They're translating it. I think they're translating it into other languages right now. But the Carnivore
Mm,
Diet by Shawn Baker, MD, is
mm,
the book I wrote that I think is a very good overview of this. I think it's a fundamental book that people that do this have found a lot, and it's easy to read. I wrote it intentionally so it'd be easy to read. I have some social media. I'm on YouTube at Shawn Baker MD. I'm on Instagram, if you like that one, at Shawn Baker 1967. That's the year I was born. I'm on Twitter, or what's now called X, at S Baker MD. And let's see, the World Carnivore Tribe that you mentioned, that is my I started that group, but I don't really spend a lot of time on Facebook. I've never been a fan of Facebook. I'm sorry.
it's
And then of
okay.
course Rivero is, Rivero or carnivore.diet. We have a lot of international people in there. And so we have people that come in there to learn about carnivore and get a supportive community. As I mentioned, it's important to have a supportive environment. And so if you don't have any in the family or friends that are going to support you, come on over to our community and we'll be happy to have you there and, help you out. So anyway.
Thank you so much, Dr. Shawn. So this episode is actually in celebration of our International Low Carb Awareness Week, ILCAO 2023. And this is being streamed from December 1 to December 7th. But you can also rewatch it anytime you like. This will be available in our YouTube channel, Facebook, Twitter, and also on our website. So thank you so much, Dr. Shawn. We actually encourage others to help others inspire as well by making a 1-minute video answering how did low carb or meat-based eating changed my life, use hashtag ILCOW2023, or you can help those surrounding you in your area to do it as well. So how to do low carb or how to do carnivore, how to do meat-based eating in your locality, and hashtag ILCOW2023 to help promote healthier lifestyle. As what you said, it's one of the most superior kind of diet that any person can actually do, because that's what I also tell my patients and my friends. If you compare yourself to a plant and compare yourself to a cow, we are actually more of a cow than a plant. So of course you would want to nourish yourself with something that you are similar with, and that's just a very basic idea, but it is also being supplemented and supported by scientific studies, unbiased scientific studies, of the benefits of meat-based nutrition for better health. Any last words, Dr. Sean, before we end?
Well, I think it's very important for you guys to again. I tell this to everybody: you've got to take care of your own health. I mean, don't outsource it to somebody else. Get involved. Critically, if someone's telling you something, critically evaluate it, test it on yourself. Make sure you get the objective results that you want. Just don't blindly follow what your doctor tells you if you're not getting healthier, because it's they only spend a very short period of time with you. You have to live in that body every day of your life. So don't outsource your health to somebody else. Take control and ownership over your own health and figure out what works for you. And it may be carnivore, it may be something else, but it's important that you assess these things and objectively test them out.
Thank you so much, Dr. Sean. So we'll say goodbye for now, and we hope to see you all in this coming International Low Carb Awareness Week and in our communities and beyond. Thank you so much. Bye bye, Doctor.